Sometimes I have to have conversations with families that they really just do not want to hear. And I mean, this is from the consulting side as a geriatric care manager. And so a lot of families are dealing with advanced dementia right now. And they have a hard time accepting that, unfortunately, you may have to do a little bit of lying, right? So I have a family who is going through another family member is passing away. And they want to include the family member with dementia as much as possible. Now, here's my stance on this. And this is from my own experience, as well as just seeing the aftermath and the after effects. Sometimes you have to tell a little white lie to people with dementia because you have to deal with the aftermath of what's coming beyond the funeral, what's coming beyond all of this increased action and all these people around and this overstimulation. You have to kind of deal with that, and you have to think about that. It's not just in the moment. I always like to talk about dementia people with the dementia diagnosis, having to be reprogrammed in a sense. Once you get them to a good, mild area, they've kind of plateaued, the behaviors are not spiking every day, that's a good place to be in. But when you introduce them to overstimulation and crowds and things that they can't process, it's very challenging for those with dementia to process death. So I tread lightly with families feeling as if they are mandated to take them to funerals or mandated to tell them about death. When my father was sick, he had a sister that passed away unexpectedly, suddenly. My family was so upset with me because A, I wouldn't let him go to the funeral. B, I didn't tell him about her death. They could come and see him, and it was good to see family. At this point, he remembered people, but he didn't remember people. So he was very nice about acting as if he did in their presence. I had to gauge, okay, so when you all leave, I have to deal with the nights of him not sleeping, the increase of sundowning, all the things that I have to deal with to get him back to a normal life. It's not worth it, especially when, with my dad, depression was a big part of his dementia, and also with him having previous strokes. He would cry and cry and cry. So why introduce him to something that he won't understand? He may have asked about that sister once or twice in the 5 years that we were on our journey, and it just didn't make sense to me to